Matthew, thanks for coming in today. Can you tell me a little bit about yourself and what brings you to the doctor today?
Well, I'm just here for my physical exam.
Okay.
Because I want to play sports.
All right, that's awesome.
Yeah.
Give me your full name. I'm going to make sure that it's written down here properly and your address.
I'm Matthew Joseph Healy. I live at 122 Willow Avenue in Corte Madera.
Okay, great. I've assessed him for his mental status. I've assessed that he's clean, he's dressed well, he speaks well, and he's physically fit, and we will assess that, and that he has good mental status at this time. Okay, Matt, so I'm going to start the exam, but first I'm going to wash my hands, and I want to check your scalp. We're going to go from head to toe, and I'm going to do a full physical on you. So I want you to sit up real tall for me and look a little bit forward. I'm going to check the skin of his scalp for any lesions, tenderness, lumps, masses, and his scalp looks fine. Hair distribution looks fine. The texture and integrity of his skin is good. I'm going to start with his head now and check for the contour, swelling, any symmetry. All looks fine. I'm going to check his sinuses. Do you have any pain here?
Mm-mm.
Any pain here when I do this?
Mm-mm.
Okay, sinuses are good. I'm going to check his lymph nodes and sit up real tall. And so I'm going to start with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, deep cervical chain, posterior cervical, and supramandibular, supraclavicular. All right, now I'm going to continue on and check your eyes. Your eyes look very good. I'm checking the skin for skin integrity around his eyes, his eyebrows, his eyelids, the lower lids, sclera, medial canthus, lateral canthus, iris, pupils, and limbus all look intact. I'm going to check for I'm going to check for pupillary reaction.
Yeah, it's on.
Okay, sorry, this light is...
There it goes.
This light is acting funny, but it's okay. So I'm checking for pupil reaction is fine. I want you to follow this. I'm going to check for accommodation. Good. I'm checking for coronary reflection, and the coronary reflection is good. So peral is fine. Eyes all look good. I'm going to now check his peripheral vision. So tell me when you can see my fingers wiggle.
No.
Good.
No.
Excellent. Look at
No.
me. Good. Okay, your peripheral vision is in good shape. Your eye exam looks fine. Now I'm going to check your ears. And the outer ear looks fine. The skin integrity, there's no drainage, no swelling. They're both symmetrical. Everything's fine on both ears. The inner ear canal has no drainage. I'm going to do 3 hearing tests. The first one is the Weber. And tell me, can you hear this in both ears? Yes.
Yes.
Okay, great. Now I'm going to see an ear conduction. Can you hear this?
Yes.
Tell me when you stop hearing it.
Now.
Now, can you hear this?
Yes.
Tell me when it stops.
Now.
Now I'm going to check on both ears for that. You hear it?
Yep.
Stop. When does it stop?
It stops right now.
Good. Do you still hear it?
Yeah.
Stop.
It stops.
Good. And so now I'm going to do the whisper test, where I'm going to plug one ear and make noise with my fingers, and I'm going to say a word or something, and you're going to repeat what I said.
9-1.
Very good.
Baseball.
Very good. Okay, your ears are in good shape. Your hearing is fine. We're going to move on to eyes, ears, nose. I'm just going to check your nose. The outside of the nose looks fine. Any nasal bleeding? No.
No.
Okay, now let me check inside your nose. For mucous membranes are clear and fine, no problems. And now I want you to just close your eyes for a minute. I'm going to have you smell something. Tell me what it smells like.
Alcohol.
Okay, awesome. So your ears, eyes, nose looks good. Now I'm going to check your throat. And the first thing I'm going to do is put on some gloves. And then I'm going to open your mouth for me. Stick out your tongue. Straight out. Good. Put it in your cheek. Good. Next cheek, other cheek. Okay, now tongue up for me. Down, side to side. Okay, now I'm going to inspect the tongue. I don't see any lesions, any cancerous looking lesions on the side of his tongue or underneath his tongue. I'm going to check the gag reflex. Open your mouth, say ah. Check gag reflex is positive and good. His teeth, all look absolutely beautiful, actually. They're straight, and all the teeth are there. And any pain?
No.
Okay. For his vital sign check, I want to ask you, back to vital signs. I didn't do vital signs, did I? Okay, I'm going to do a vital sign check now. I'm going to check for his blood pressure, pulse, respirations, temperature. Do you have any pain at all on a scale of 1 to 10?
0.
Okay, good. Height and weight was fine, and his pulse oximeter is 99%. He's in a normal BMI. Okay, so we're still in the mouth. We're going to jump back to the mouth now, since I forgot the vital signs. And we are going to, I see that the mouth is pretty much in good condition. So the pillars in the back look fine. The uvula was in the right spot. Now I'm going to check his neck. The skin around the neck looks good. Anterior and posterior triangles are present and looking well. His sternocleidomastoid and trapezius muscle looks fine. His hyoid, cricoid, and thyroid cartilage are all aligned lovely. I don't feel any masses on the right or left of his thyroid. I'm going to go around and have him swallow for me. Swallow. Okay, there's no lumps or masses that I can feel. So I've done the head, eyes, ears, nose, mouth, neck. I've checked your sinuses. I've done your lymph nodes, right?
Mm-hmm.
And now I'm going to move on down the line to the shoulders. If you could shrug your shoulders for me, good. And I'm going to press on them and you shrug them against resistance. Good, you're very strong, I see. Okay, now I'm going to check range of motion of the upper body. So what I would like you to do is, in exaggerated motion, I want you to put your arms behind your neck. Good. Now in exaggerated motion, I want you to put your arms behind your back. Very good. And that was checking the shoulder range of motion. Now I'm going to check the elbow range of motion. You're going to straighten your elbows. Pronate, supinate. Very good. Your wrists up and down, side to side. Your fingers, spread them and close them. Hand grips. Grip my fingers. I want to see how strong you are. Excellent. Now I want you to do alternating movements. Rapid alternating movements with your fingers like this. Back and forth. Very good. Now on your lap, back and forth. Okay. Upper range of motion, good. Now I'm going to have him do some leg raises for me. Put your leg, extend your leg, and lift. Okay, lift against my resistance. Okay, straight leg raises are good. And they're strong against my resistance. Now lift your leg as far up as you can. Straight leg raises. Okay, next one. Okay. Good. Okay, the upper body muscular is good. Now I'm going to check for neuro and sensation. Can you feel my hands?
Mm-hmm.
On all up around his extremities are good. Now I want you to tell me if it's sharp or dull, and I'm going to poke you gently. Close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull.
On the feet.
Sharp.
Okay. Good neuro so far. Now I'm going to test his reflexes, and I want you to extend your arm for me, and I'm going to check the brachial the bicep tendon reflex. Relax your arm. Okay, good. Now I'm going to check the tricep reflex. Excellent. And same on the other side. The brachial, tricep, the radialis, brachioradialis. Okay. The knee. Here, extend your knee. Dangle your knee. Oh, very good. And now your Achilles and the Babinski sign I'll do later. He's laying down. Okay, I've done your neck, your range of motion. Now I finished your neuro, and we're going to move on to the lungs. Okay? If you can sit up straight and tall for me, I'm going to do this in a sitting position. And first thing I'm going to do is check the anterior posterior. I'm going to inspect and check the anterior posterior diameter and the transverse diameter. And now I'm going to percuss the front of his chest. And the back percussion. In 7 positions. Okay. The percussion sounds good. So I've inspected. I see no cyanosis when I inspect. The color looks good. There's no swelling. Is there any chest pain that you are experiencing? Or
Nope.
Has any cough? Any?
Nope.
Do you have any? Do you have any concerns with your chest
Nope.
or lungs? Okay,
Nope.
good. Skin integrity was good. No cyanosis, color, no swelling, no lesions, no masses. Okay, I've inspected. I've percussed. I'm going to check for fremitus now. With this part of my hand, say 99.
99. 99. 99.
Excellent. And on the back in 4 positions.
99. 99. 99. 99.
Alrighty. Now I'm going to listen to his lungs. I'm going to start in the back and I'm going to have you stand up just to show the camera. Turn around. Deep breath in and out. Okay. Now, in the front, you can sit back down again. I'm going to auscultate the front. Deep breath in. His lungs sound clear, and no, everything sounds fine with your lungs. So now I'm going to have you stand up, please. And I'm going to have you bend over, and I'm going to check your back. Okay, touch your toes. And I see that his spine is in good alignment. There's no lordosis, scoliosis, or kyphosis. Okay, you can come back up again. And sit down. I'm going to check your neck once more while we're doing a little bit of musculoskeletal. Can you please put your chin to your chest and head back? Okay, side to side, ear to ear, your ear to shoulder. Okay, your neck is in a good position. Did I do that already? No. Okay, good. Thank you. All right, so we are doing well. I'm going to actually now do a assess your heart. So I'm going to have you lie down over here at the couch.
Speed.
And I'm going to move the camera. Head over there where the pillow is, please. I'm going to move the camera where you can see it. Us. Looks good, I think. All right. So I'm going to start with checking his heart for heaves, lifts, thrills with my finger pads. And I check the aortic area, the pulmonic area, Erb's point, the tricuspid area, mitral area, and point of maximal impulse, the apex. Now I'm going to listen to his heart in those same areas, the aortic, pulmonic, just listen to your heart, just relax. Erb's point, tricuspid, mitral, and point of maximal impulse, the apex. Now I'm going to listen to murmurs. For murmurs, I'm going to turn it to the bell. Same points. Okay. The heart exam was fine. Now I'm going to move to the vascular exam. I'm going to check his legs first for hair, any hair distribution. Hair distribution looks fine. The color and the integrity of his skin looks good. His skin turgor is good. His capillary refill time is less than 2 seconds on his toes. And can I have your finger, please? And his finger. Excellent. There's no veins, no varicosities, no angiomas. Skin integrity looks good. I'm going to now check his pulses, but first I'm going to check for bruit in his carotid artery with the bell. Good. Now I'm going to check his pulses, his carotid pulse on both sides, one after the other. Sound fine. His radial pulse, we checked earlier, is fine. Or excuse me, his brachial. Good. Radial is excellent. His popliteal artery sounds, I could feel that is fine. Popliteal, femoral is fine. Popliteal is bilaterally is all fine. His dorsalis pedis is good. It's not bounding. All the pulses are non-bounding. They're in good range. There's no edema, no pitting edema, and the color is good. Dorsalis pedis pulse was good, and posterior tibial pulse is good. I actually feel these. They're fine. It's hard to feel those. Okay, so we've done the vascular sign. The vascular signs, I'm going to end vascular with the Hohmann sign. And I want you to dorsal flex your foot, bring your foot up and check for pain. Any pain?
Nope.
Good. Now the Babinski sign, I'm going to check again with my tuning, or my reflex fork. Okay, negative for Babinski sign on his foot. And now I'm going to do one last thing with the vascular, and that's the aortic, or that's the vascular pulses, or veins. Listen to the veins with the bell. So aortic, renal, iliac, and femoral on both sides. Okay, now we're going to move to check the abdomen. So, first thing I'm going to look at is, auscultate for vowel sounds. In all 4 quadrants. Good. Now I'm going to percuss in all 4 quadrants. Timpani or dull sounds. Very good. Now I'm going to do light palpation for masses, tenderness, any masses or tenderness. Now deeper palpation for masses or tenderness with 2 hands. Light was 1 hand, deeper is 2 hands. I'm going to check for his appendicitis. For McBurney's point is 2/3 of the way from his umbilicus to his iliac crest, and there's no any tenderness here. No. Okay, before I do the psoas sign and obturator sign, I'm going to inspect his abdomen for the contour of his umbilicus, for any scars, lesions, swelling, veins, and I don't see anything. His abdomen looks fine. I'm going to now check for psoas sign and obturator sign. So can you lay on your side for me, please? That side. And I'm going to take the straight leg and bring it back toward me. Do you have any pain in your lower right lower quadrant? No, right lower quadrant pain. And then I'm going to check the obturator. Any pain in your right lower quadrant? Okay, good. Okay, you can turn back over. Okay, now I'm going to see. I've done timpani. I've percussed. I've listened to your vowel sounds. I have felt them. I have checked the, okay, I'm going to check the Murphy sign for gallbladder tenderness under the coastal region. Do you have any pain here? All right. I'm now going to do a genital examination, and I'm going to wash my hands, and I'm going to turn this up a little bit so you can see me. I'm going to put a blanket over him for privacy, and I'm going to do a genital exam on him, and what I'm going to do is just talk them through it. I didn't warn you about that. So basically we're going to start with, I wash my hands, I put my gloves on. I check the genitals for any drainage, any redness, any rashes, any sores, any swelling, that it is everything's symmetrical and good, and it is, and there's no drainage, there's no lesions, nothing worrisome looking down there. I'm going to palpate now his femoral artery. I'm going to palpate the inguinal area for hernias, and I don't feel anything. I'm going to palpate the lymph nodes in that area. I don't feel anything. I'm going to ask him to raise your head and take a deep breath and check for hernias in the area. I don't see any. So far, so good. I'm going to check the perianal area for skin integrity, and I'm going to check for hemorrhoids. I don't see any. I'm going to do a digital exam, and I'm going to check his prostate. I'm going to check for hemorrhoids and fistulas. And then I'm going to take off my gloves after this exam and wash my hands. I believe I have finished the examination except for one point that I can think of, and that is I want him to stand up so I can check his joints for even equal distribution. Okay, sorry about that, but I have you stand up. Oh wait, while you're laying down, hold on, sorry. Put your legs down. I'm going to check lung expansion. Take a big deep breath for me. Beautiful lung expansion. Okay, now stand up. And I'm going to check his joints for leg length discrepancy. I'm going to stand back, and I see that he's fine. There's no lesions, nothing worrisome that I am noting. Everything looks symmetrical, no lesions, no leg length discrepancies. We're finished. And I've recorded everything. I've recorded the blood pressure. I've recorded everything, and thank you. I've recorded all the vital signs.